I'm Patricia Andreu, and welcome to our special Caring for the Aging. Did you know that Florida has more residents over the age of 60 than any other state? That number will continue to rise as more baby boomers reach retirement. Thanks to healthier lifestyles and scientific breakthroughs, people are living longer and expect a better quality of life as they enter into their 60s, 70s, and beyond. Over the next half hour, we hope to share important information about how you should prepare for the future and tell you about key resources in our community that can help you and your family in a time of need. Now, as people get older, you may need some extra help, like after surgery, if you can no longer drive, more help than perhaps a family member can provide. Well, there is a way to get help for you without having to leave your home. Up until last year, 87-year-old Rhoda Gelwarg and her 90-year-old husband Dan were working part-time and living together in their Delray Beach home. But then Dan started suffering from dementia, and Rhoda learned her lung cancer had spread to her liver. The once feisty and self-sufficient Rhoda realized she needed support. How did you finally arrive at the decision that you needed an extra set of hands helping you in the home?
Well, I had a lot of help with that decision. I resisted it ferociously. I said, I can do it all myself. So I was taking care of my husband, going for chemo. My children were screaming at me, and finally I had to give in. They said, Mom, you can't do everything. Pardon?
What Rhoda did was call Whitson's nursing service. They helped care for her husband until he passed away, and then she got live-in help for herself.
I'm receiving terrific care. Lisa's here round the clock, 24 hours. She's wonderful. She does everything. Whatever I need, I just say, Lisa, and she comes running. What can I do?
Well, you can pretty much have a seat because I'm almost ready for you. That involves a little bit of light housekeeping, you know, a little cooking. You do a little laundry, personal services as far as where if they have to do doctor's appointments, you could take them there. You will help them around the home as far as if they need shower, you know, changing, anything personal within their home that they're unable to do or would like help to do. I'm there.
Whitson's is Florida's largest family-owned private-duty nursing service company. Vice President Randy Ritzko says they have thousands of active caregivers in their database ready to serve patients' needs.
The caregivers are all licensed, bonded, and insured, and their licenses, depending on the needs of the patient, there's different levels of caregiver credentials. So we have home health aides, we have certified nursing assistants, and then we go into even higher levels of skilled nursing, such as LPNs, licensed practicing nurses, and registered nurses, RNs.
Getting help is as easy as making a phone call.
They will contact Whitson's Nursing. We'll do an intake with them over the phone. It's basically interviewing the patient, understanding, or the family member, understanding exactly what is their condition, what are their needs, what are they looking for, what assistance can we provide to them.
And when I had my operations, I needed company, I needed understanding, and I need caring, and that's what they provided for me.
Maxine Jaffe has been a client on and off for years. She's a repeat customer because of the excellent care and the fact that it's hassle-free. The service agreement is so flexible she can easily stop or change the amount of help she needs.
They did everything to please me. That's the important thing. And they were very comforting, and they were very sweet. Their whole attitude was helping me to get better.
And they did.
And they certainly did. I'm very pleased.
The caregivers also give peace of mind to family members who live far away.
They will always have my cell phone number. They'll call me and check in and make sure everything's going okay. Their, parents is happy and that they're getting good care. And I always keep in contact with the children.
I like to help people. I like to make sure they're comfortable, make people happy.
And Whitson says that half of their patients self-pay. The other half, like the two women you just saw in that story, use their long-term care insurance to cover costs. Both women say that they're very grateful that they got that insurance years ago. Many people, as they age, they prefer to stay at home, and we're here now with Shauna Skeen from Whitson's Nursing Service. We saw in the story earlier tonight these two ladies who had help for a variety of reasons. Your company is very flexible in the kind of service you provide.
Yes, we tailor the services to the patient's needs. So if the patient just needs a bath visit, we can provide that as well as a live-in service. We do accept long-term care insurance, and the patients can also pay privately. Whitson's Nursing takes the burden off the patients by doing all the paperwork for them for the insurance companies. Just give us a call and we will quote you a rate based on the services that you need.
And I know paperwork can be very confusing and confounding, especially when you need help and you want somebody right away. So that's a big service that you provide there. What about with, you can call and get service within 24, 48 hours?
Yes, between 24 to 48 hours we can get a caregiver out to you.
Okay, well, thank you so much. If you were unable to call our experts now that our phone bank is closing, please check our special website, agingcare.tv, for links to these experts and their companies. On behalf of NBC Miami, thank you so much for joining us for our Caring for the Aging special. We hope that you got a lot of information here. We hope our experts were able to provide you with a lot of help for you and your loved ones. Thanks so much for joining us, and have a good evening.